Hey, it's Chad again with the 5 by 5 vlog. I wanted to talk really quick about patient safety in response to a video article, a situation that happened about a year ago at Vanderbilt Medical Center, in which a nurse inadvertently gave becuronium instead of Versed to a patient, and the patient ultimately died because of it. Zdogg MD had a video about this that kind of got me thinking about what is my duty in this situation as a nurse, someone with a pharmacy background, someone that gives these medications almost daily. Um, and the way he um, brought it up was like, if you have 2 cents, if you have an idea, share. We need to talk about these things. If one person changes their mind, their way of thinking, if it leads to a policy change, whatever happens that could lead to a patient's life being saved in the future, it's worth it. So thank you, Zdogg MD. This is my response. I will be as quick as I can. Um, Really quick, so this patient was brought in. It really doesn't matter what for. They had to go for a test. They were anxious about it. They were supposed to be given Versed, which is an anti-anxiety hypnotic drug, sedative, and instead they were given vecuronium, which is a paralytic. It paralyzes the body. You can't speak, you can't talk, you can't move. So it was a huge, 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 unfortunate, horrific tragedy. The patient died from it, and the obviously we don't know all of the details. There's a lot of investigation that has to go into these things. There's details that aren't going to be released in the press. All we really know is the nurse that gave the medication overrode it in the medication system and typed in the letters of VE for Versed and ended up picking vecuronium. When you go through an investigation like this for pretty much anything, do something called or close to a root cause analysis. Because we don't have all of the details that take us through the timeline of events, from the fact that the patient was awake, alert, and asked for something, to the doctor prescribing it, putting the order in, waiting for the machine to pick up the order, the nurse going to the machine, scanning the arm bracelet, medication. There are a lot of things there we just don't quite know yes or no. We can probably guess, but then again, at the end of the day, we don't know. So when I was reading through and listening to Zdogg describe the situation, I had to put myself in the same scenario. If I was in this position and I decided to override and ignore every safety feature that was already in place, how would I have prevented myself from making the same error? And would I have been able to prevent myself from making the same error? And also, if I had to globally assign a solution to this, again, not knowing all of the things that were ignored, missed, whatever, you have to remember that it has to be like a solution. When you do a root cause analysis, has to be globally applied, has to be able to be used in any situation across the board, or you're not finding the root cause, you're finding a seed of the potential cause, but not the whole, like that one thing that could really solve the whole problem. So a lot of people are going to go straight for the override. She shouldn't have been able to override the medication. She shouldn't have chosen to override the medication. What steps do we need to put in place in order for the override not to happen? They're all going to go for that. And that makes a lot of sense, because had she not been able to override the medication, then chances are the doctor would have put the right order in, and the right medicine would have been taken out of the medicine cabinet, and the right medication would have been scanned. All of those safety measures had been followed, then yes, you could say that your outcome, very, very, very high, 9900%, would have been different. However, again, when you're applying a solution across the board, you have to take into account what things are going to change or potentially change over the course of time. And there are things like downtime, system crashes, electricity could fail. There are a lot of different things that could potentially affect our ability to not override this medicine. Um, situations where a patient doesn't have time to wait for the drug to be given and an override has to happen because waiting that 3 or 5 minutes could be the difference between someone living and dying. So, taking all of that into account with the situation that we have, what is the solution? What went wrong? How do we get from um, an unsafe scenario to a more safe scenario, moving toward zero harm, which is a big theme in the medical community right now. It's very popular among all of our oversight organizations and the third party companies that we use as hospitals to help improve care and patient experience. That as healthcare professionals, we need to be on a path, on a journey towards zero harm every day, and be constantly willing to change and evolve and be change agents in our organization so things are much more better and they are safer and the patient experience is as grand as it can be for someone that has to lay in an uncomfortable hospital bed for 12 hours, 48 hours, however long their stay may end up being. So, in my head, thinking this through, trying to determine what went wrong, I think that it has to do with a lack of knowledge and understanding of exactly what she, as the nurse, was doing and getting. Um, Again, putting myself in the exact same situation, ignoring every safety measure that most hospitals these days have, that I said a bit ago, even ignoring all of that, the fundamental differences between these two drugs should have stopped her as soon as she had reached for the medication to pull it out of the machine. Before she ever stepped foot in the patient's room, before she ever popped the top to draw the medicine up, that itself should have stopped her. Now, I know that there are a lot of different drug companies out there, a lot of different formulations for things, a lot of like many different companies buy the generic form of a drug and slap their own name on it. That's where you get Versed. Its generic name is actually midazolam. No matter what other name you give it, midazolam will always be midazolam. So Versed is the drug name. Vecuronium, on the other hand, is the generic name. Norcuron is a common trade name given to that medicine. And that's pretty much where the similarity between these two drugs ends. Like that's it. VE is it. So again, going back to put myself in the shoes of this nurse, where would I be at? So first of all, um, technology aside, safety measures that involve technology aside, at the end of the day, I'm going to have looked at that medication vial 3 different times before I ever give it. The first time is when I pull it out of the machine. I'm making sure that I'm getting out the same drug that I intend to give my patient. And I have already thought in discussing with the doctor the needs of the patient, is the drug appropriate? So I've already determined the patient's not allergic. They need Versed to calm them down. It's an appropriate drug, it's an appropriate dose. Those things I've already done. Now I'm looking at it getting out of the machine. The second time I look at it is when I go to draw the medicine out of the vial into a syringe in anticipation of giving the drug. So now I've looked at the vial twice. The third time is when I'm at the bedside and I've scanned the patient's bracelet and the medication, and I'm looking at making sure all of these things line up together. Okay? So again, if I take technology aside, the third time I'm looking at it is when I'm going to give it. Like the vial's right there with me when I go to push this drug. I have Versed in my hand, I'm pushing Versed. Like that all happens right there. So that is something that I and hopefully all of your nurses are doing anyway, without the help of technology, that is just part of their routine practice as they pull it out, as they draw it up, and as they give it. The next thing is the number of differences between the two drugs in a visual aspect. So if I laid vials of vecuronium and Versed down in front of you, you as either a nurse professional, a physician, or a layperson, someone that is a lawyer or has any other job known to man, could name off differences just by looking at these two vials. So we'll go with vecuronium first, and please look these up on the internet and compare. And the reason I'm using the details that I'm using here, because I will tell you, if you do Google this, you're going to notice some differences too. There's a bit of variety, but for the hospitals that I've worked in um, and seen and given these drugs in, they've always been the same. Like I haven't had any variation in the ones that I've given. So when I talk about the details, that's where I'm coming from. Um, Vecuronium. So vecuronium is a paralytic. It comes in a bigger vial than Versed. It's a glass vial that's clear. It's a very clear glass. It has a red cap. It's a powder, and it says vecuronium 10 milligrams on it. So now we'll go over to Versed. Versed, there's a lot of the variety of that medicine, but the common dosages and vial sizes are 2 and 5. So it says midazolam or Versed 2 milligrams and 5 milligrams. Those are both smaller than vecuronium. The glass that it comes in is a dark, like caramelized color. The tops are typically orange, and it's a liquid. And no place that I've ever worked, no vial that I've ever seen of either of these two drugs is that detailed different. Vecuronium I've always seen as a powder. Versed I've always seen as a liquid. So getting down to the nitty-gritty of what happened and why this occurred, again, I have to say it's a lack of knowledge, education. Unfortunately, I have to use the word competence here. As soon as that drug was pulled from that cabinet, immediately looking at it, you're gonna know it's the wrong medication. There's just so many differences between the way these things look that the stop should have been right there. However, let's say that that knowledge wasn't there, that you didn't have stuck in your head that vecuronium was clear glass and Versed was dark caramel glass, or whatever detail I had named off. So the next thing that I feel would be an incredibly hard stop for me is the fact that you would have had to have taken like saline flush and mix that powder up with the flush in order to create a liquid so the drug could be given. There are very few medications that we typically have to mix a powder in. Most of them are antibiotics that go on a saline bag, and we mix them together to drip in the antibiotic. That's most of them. The other big one is TPA. It comes as a powder, and it also comes with its own diluent, and it's a huge vial. It's a really big one. And other than that, there's not a whole lot of other powders that I can think of. So the fact that you're having to mix a powder is more of a not so common thing than having a drug that's already a liquid that you're just drawing up. So for me, having made that error and drawing up a powdered form medication, that should have been a really big, wait a minute, something is wrong here. And then of course, just the as I said earlier, the looking at the vial 3 times, mixing of it, the differences in appearance, and all of these things have absolutely nothing to do with technology or safety measures that we have implemented that utilize technology that help us as human beings avoid errors that human beings make. So at the end of the day, what solution can you apply globally, whether you do or do not have this technology that we're all becoming very, very reliant on? And I'm not saying that's a bad thing. I think technology is great, but there does come a point where you have to have common sense and critical thinking in your tool bag, because there is a chance that one day you're not going to have the technology you're used to having, and you're going to have to find another way to think through this process. And So my solution to this would be that there definitely needs to be an overhaul of the education that's given to our nurses that are in these critical care areas that potentially are going to take care of somebody that needs these medications given. In the ER, where I work, I consider these both of these drugs, vecuronium and Versed, um, must-haves when it comes to a nurse knowing when, how, and why you're giving it. And a nurse should know when, how, and why to give any medication, but these are definitely two that are really high up on the must know for a high acuity patient. Um, which leads me to talking about education itself. I think that there is definitely a disservice to nurses and the profession as a whole when we have educators in school that are pretty much hands off, sit back. I need you to learn this information, be a self starter, be ambitious uh, um, and confident, and making sure that you're taking your career in your own hands. And while that is all well and good, and to a degree, it is necessary for uh, students in nursing school to be very self sufficient and self reliant and having that own personal drive to get the information learned and done, there comes a point where it's also negligent to the profession of nursing. And that needs to stop. There needs to be a more hands on approach to our educators at nursing schools, making sure that the tools and knowledge that they need to have is put in place before they ever get to the job location. Things like vecuronium being a powder and Versed being a liquid isn't something that you're going to find on the NCLEX. The NCLEX is more about um, knowledge of disease and pathophysiology and critically thinking your way through a case. What is more important for a patient to have versus what can wait? Like, it's a lot of critical thinking, not critical care, if that's what I said. So a question specifically like that isn't going to be on there, which is why I find it very fortunate that I had educators like Teresa and Stephanie telling me every day that we were at clinicals or in the classroom, in the lab, whatever. Put I need to check you off on how to put a Foley in. Do you know how to do it right? Okay, what are the steps? Oh, and by the way, you don't push potassium IV. Like, you never push potassium IV. Or we could be sitting eating fries for lunch, and oh, and what's that drug that you don't ever give IV push? It was constantly little things were ingrained, and by the end of that first year, um, it was like second knowledge to me. It was like knowing my name or knowing tomorrow was Tuesday. It was just there, and I think uh, you don't get that just by reading a book. You don't get the importance of stuff like that by reading just by reading a book and learning knowledge and about disease processes. And then uh, you have, so on one hand, you have the teachers that are kind of how the hands-on approach at school, and then once someone passes the NCLEX and they have a license and they can practice, and they get to the hospital setting, and the educators there typically have the same kind of attitude. You've been in nursing school, you should know this, you know your scope of practice. Here are the steps that you're already going to tell me you know because that's what everybody does, and you're going to sign a piece of paper that says you're good and competent and you're going to move on. And that is a disservice to the nurse, it's a disservice to the institution, and like the big one, first and foremost, it's a huge disservice, a danger, huge danger to the patients that we have dedicated our lives to protecting and treating and making well, helping them live their best life. So I leave it there. I hope this video was informative and not too over the top. Questions, comments, concerns, criticisms, please leave them in the comments. I will leave my email address as well if you would like to reach out that way. Please check out my other videos if you so choose. And until next time, I'm 5 by 5. Please be the change and make it count.